When I was a medical student, I was taught there are two types of people in this world: those with piles and those who lie. First things first, piles are just another name for hemorrhoids. These are exactly the same thing. I see quite a lot of this in clinic, but this is definitely something you can manage at home. Piles are swelling around the back passage. Our digestive tract, all the way from our mouth to our back passage, is basically one long glorified tube. Like every part of our body, this tube has a blood supply in the form of vessels to keep it alive. When the blood vessels and surrounding tissues around our back passage get swollen, that's when we get piles. Something similar also happens when people get varicose veins in their legs. And when it happens in our back passage, the veins get bigger, hold more blood, and, well, form small piles. To be honest, we don't know why some people get piles more than others, but we do know there are certain things that massively increase the risk. Almost all of these are related to an increased pressure around the back passage. So, for example, constipation and straining on the toilet. When you strain or spend hours on the toilet, you get pressure around the back passage that can literally cause swelling and piles. It's also the reason people who are overweight or pregnant tend to get piles too, and those who do a lot of heavy lifting, and even those who have a persistent cough. Put your hand on your tummy and cough. Do you feel that pressure? That can transmit all the way to your back passage. As we get older, many parts of our body can become less supportive and weaker. The back passage is no exception, and hemorrhoids definitely get more common as we get older. Yes, but the underlying cause is the same. They only differ in either where they are in the back passage, either high up in the back passage, which are internal, or close to the end of the back passage, which is external, or the degree of severity. Severity here is defined as whether these piles protrude from the back passage or not. As piles get bigger, they can literally go from inside the back passage to outside the back passage, i.e. you can feel it with your own finger on the outside of your back passage, or your doctor can see it if he was examining you. This is called a prolapse. There are 4 types of severity of piles, known as grades. The commonest types of piles are grade 1, and they don't prolapse or protrude. In this case, the piles are usually small, and they may not even bother you. Grade 2 piles do prolapse, but only when you strain, and they go back into the back passage themselves after straining. Grade 3 piles prolapse after straining too, but don't go back into the back passage after straining. They dangle by the entrance of the back passage, and grade 4 is when the piles are always protruding. FYI, although grade 4 piles sound like they're the worst, and they usually are, it doesn't mean that they have the worst symptoms. Grade 1 piles can cause no or very severe symptoms, and grade 4 piles may cause no symptoms at all. Often nothing. Sometimes people don't even know they have piles, and it may sort itself out. Having said that, a lot of people do have symptoms, and the common ones are bleeding from the back passage. This one naturally freaks people out. Sorry to get graphic, but the blood associated with piles is usually noticeable on the tissue after you wipe, or it's kind of sprayed onto the toilet bowl, or it drips at the end of opening your bowels, and it's almost always bright red. All of these are common, and 9 times out of 10, if you have this type of bleeding from your bottom, it's likely to be piles. By the way, a small amount of blood loss from your back passage can often feel and look like a lot. It's rare that people lose so much blood that this becomes a problem too. Anal itching is another problem. This is one of the commonest causes of bum itch. That slight awareness that your back passage exists and it doesn't feel quite right. Bowel discomfort is common. Just feeling a little different when you open your bowel, slightly uncomfortable or full, or even incomplete emptying, or not quite emptying at all. All of these are symptoms of piles. Interestingly, pain is not a common feature. Piles can be painful when you open your bowels, but they're not usually painful when you're not opening your bowels. If it's painful down there most of the time, then you probably should get that checked out. Also, if you have blood from the back passage and it's mixed in with the poo rather than splattered on the pan or the tissue, then that's a really important reason to see your doctor. Piles are generally self-contained. They come and go, often many times in someone's life, and rarely cause secondary problems. Having said that, if you can imagine a grade 3 or 4 pile, any pile that's prolapsed like a grape on a stalk, sometimes that pile can get twisted on itself and it can become really painful. This is called strangulation, and it can cause a clot in the pile itself. If this happens, then this is another reason to see your doctor. The good news with piles is that if they're mild, i.e. they're not bothering you that much, there's a small amount of blood or there's slight irritation in the back passage, you can consider managing them yourself with treatment you can buy over the counter. If you're not sure what's going on, or you just want to get checked out or have more annoying symptoms, then do discuss with your healthcare professional. If you end up in clinic and do see your GP, they'll tend to be interested in how long you've had the symptoms for, if you have any family history of bowel problems, and especially if you have any red flag symptoms. These symptoms indicate more serious disease, such as rapid, unexplained weight loss or decreased appetite, or blood mixed in with stool, as I mentioned earlier. Piles is common, but it's my job to make sure you don't have anything else more worrying going on. After the history, you will need to be examined, usually the abdomen first and then the back passage. To examine the back passage, you'll be asked to lie on your left side and a chaperone should be offered. The back passage will be examined and a finger examination of the back passage will be required, again to exclude anything else that could cause bleeding or irritation. You may be asked to cough or strain to help reveal a hemorrhoid. The finger examination literally lasts seconds. It can be a bit uncomfortable, but it's rarely painful, and it's an important part of the examination to exclude other causes for your symptoms. If you want to get rid of your symptoms really quickly, you'll need an ointment or suppository. If you never want to have piles again, you'll need to figure out why you got piles in the first place and prevent it happening again, so-called lifestyle modifications. Don't ignore the lifestyle stuff. I see a lot of people with recurrent piles that slowly get worse and worse, and it's almost always could have been prevented with some basic lifestyle modifications. There are two main areas to focus on here. One, keep the poo soft, fibre, fluid, and avoid constipating drugs, especially codeine, and try and avoid alcohol and caffeine too if you find that it dehydrates you. Consider laxatives such as asphagular husk. Number 2 is toileting habits. Avoid straining when opening your bowels and raise your knees above your hips. Sometimes a small chair or a stool helps with this. Check the resources in the comments below, which shows you how to open your bowels without straining and using the right muscles to push. There are loads of options to choose from, and they come as ointments with nozzles or suppositories that you apply after you open your bowels. There are generally 2 types of treatment. There are numbing treatments, which are kind of soothing creams with anaesthetic, which takes the edge off the discomfort. And there's anti-inflammatory treatments. These are soothing creams or ointments and suppositories too, with a steroid component that quickly aims to decrease the swelling. Don't worry too much about which one to choose. Almost all of them provide pain and itch relief, and none are particularly better than others when it comes to the studies. In a small amount of cases, about 5 to 10% of piles may be persistent, and despite your best lifestyle measures and treatment, things just don't get better. At this point, we may refer you for further treatment for your piles. Most of these treatments aim to stop the blood supply to the pile by things like bands or injections or heat energy, and they're straightforward daycare procedures. In increasingly rare circumstances, people may just need to have the pile surgically removed. Piles are really common. Do seek a healthcare professional if you're unsure or you have other unexplained symptoms such as pain, blood in the poo, tummy pain, or a change in your bowel habit. Seek help if you're unsure. Consider over-the-counter treatments if your symptoms are mild. Lifestyle measures are really important, and not just to prevent piles, they form part of good bowel health and toileting. Thanks for watching. Till next time, stay healthy.